Okay, we're on. Good afternoon, everyone. And we're back again, our Tuesday talk, the HER, Health Empowerment Reset. We're very excited to have a speaker today, which we'll get that in a second. But my name is Martha King, and I'm a certified health coach here in Hanover, Pennsylvania. Asha?
My name is Asha Scatchard. I'm a Barbara Brennan healing practitioner. I have a healing practice in York, Pennsylvania, and I have a website, Energy Bodyworks. Back to you, Martha.
Thank you, Asha. So our topic today, and we had advertised last week, it's the integrative approach to psychiatry, a new perspective of integrated mental health management. So when we know the symptoms, reactions, feelings, they're all connected, and how being depressed makes us hard sometimes to eat, maybe not move. So there is ways to overcome that, depression, for example. So today we have a doctor, Dr. Kcomt. He's a board-certified psychiatrist and a fellow in integrated medicine. He believes that balance in every aspect of our life, such as biological, mental, emotional, and spiritual, we can achieve a true health. So, Christian, you have the floor.
Thanks, Martha. All right, let me just introduce myself briefly. My name is Kcomt. I was born and raised in Peru. I did medical school in Peru, and then I came to the US in the year 2000 to do my residency in psychiatry. I did that at Albert Einstein Medical Center in Philadelphia. After that, I became board certified in psychiatry. I always have this in the back of my mind that human beings were having different aspects, not just the physical part, that were physical, mental, emotional, and spiritual aspects, So that took me to further my studies. I had a chance to train with Dr. Andrew Weil. I did a fellowship with him. I had a chance to learn about nutrition, about diet, exercises, to complement, the treatment. I also had a chance to train with Dr. Deepak Chopra. I got certified in primordial sound meditation and also Ayurvedic lifestyle. And at this moment, I'm training with Dr. Alberto Villoldo in plant medicine and shamanism. So that really opened up my horizon, about how to treat my clientele. I work here in Camp Hill. I have my office here. And just to understand what do I mean by an approach to psychiatry that is more holistic and integrative, I would say that in the same way I said, that I believe that true health has to take care of the physical aspect, the mental aspect, emotional and spiritual aspect to be real, lasting health. Otherwise, it doesn't last. Otherwise, it's not real, For example, what do I mean by the physical aspect, Number one, diet. Diet is a foundation for us to be healthy mentally and physically, right? There's no question about that. We get our nutrients for nourish our body and our brain through our diet, mainly. Also there are two things in this country that are really affecting us mentally. Number one is dairy. Number two is wheat. Dairy, I mean milk, cheese, and yogurt. Just the way cows are raised in this country are not the ideal, right? So we got past all these additives and hormones into our diet. And dairy is highly, highly linked with depression and ADD and ADHD in this country. Also, the second thing is wheat. By wheat, I mean bread, pasta, cookies, right? Also super, super linked to any ADD and ADHD symptoms in this country, especially in kids, So diet is super important, and also addressing any kind of constipation is good to promote health, physical and mental, Number two, about the physical aspect, I mean, working out, exercising, and doing mainly yoga, right? It is well known that diet and working out are the two main foundations for us to keep us healthy, physically and mentally, Also, when anybody comes to my practice, I try to do some blood work. Why do I do that? Because many, many vitamin deficiencies and hormone imbalances are well known to cause mental health issues. If somebody comes to me with depression and I jump into an antidepressant when they are really having an issue with the thyroid or their vitamin D deficiency, I'm missing the whole picture. So I order, to do the complete blood count to check for anemia, electrolytes to check for all the sodium, potassium, chloride. I check for thyroid, very important, because too much thyroid can cause anxiety and too little can cause depression. So I need to know that in order to have a whole picture. I also check for vitamin B12 and folate. Why? Because the deficiency causes depression and causes also issue with concentration. I check also for vitamin D. The same thing. Vitamin D is super important. Vitamin D is something that is usually not taken care seriously in this area, and lack of that can cause depression and anxiety and issue with concentration. I also check for cortisol, because too much of that also can cause anxiety. And also there are 3 minerals linked with ADD in these countries: lack of iron, lack of magnesium, and lack of zinc. All of that has to be checked. Before I jump into giving anybody a medication for ADD, I want to check that, because otherwise, once again, I'm missing the whole picture, right? So very important to have that information. Also, I use supplements, right? I had a chance to train in Ayurvedic lifestyle. According to Ayurveda, there are 3 different kinds of body types or doshas. I'm going to say this briefly. One is Vata. People are more prone to anxiety. Second one is Pitta. People are more prone to anger. The third one is more Kapha. People are more prone to depression. So depending on your symptoms, I can give, for example, somebody who has too much anxiety, I can promote ashwagandha. Amazing to relieve the Vata imbalance, therefore correcting the anxiety. Somebody has too much Pitta, I will give aloe vera, amazing to cooling the Pitta and lowering the anger issues or the acting out. Anybody who has too much Kapha, more prone to depression, I will recommend turmeric, amazing to balance the Kapha, therefore promoting and helping for depression, right? I also use vitamin B complex, amazing for energy. I also use L-theanine, amazing also for anxiety. I also use magnesium, amazing for your whole body, including relaxation and anxiety, right? So many supplements out there can really help us, I also, when I do my blood work, I also check for hormones. Any guy who is on his 40s coming to see me because of depression and anxiety, I will check for testosterone. Because at that age, if we start getting low T, and that is linked with depression, anxiety, and all these symptoms, Also in my practice, I have the chance to do something called gene site testing. What does it mean? That we do a swab inside their mouth and we get their genes. So in case we have to use medications, this test will show us what medication will be more beneficial and which one will not, according to their genes and to their liver enzymes. So we save time, we save money, we save suffering with my clients, Also, we check for something as an enzyme. It's called the MTHFR. It has a difficult name to pronounce. But it's important because it's how we absorb folate, okay? If we don't get the folate of our diet, we are more prone to having more mental and physical conditions. So we need to check that enzyme, very important, okay? And yes, we use medications or drugs. Why? Because sometimes, if somebody comes to me in an acute situation, actively suicidal, they need a medication, at least to navigate during that time, Like I always say to my clients, if I ever get run by a truck and bleeding to death, please take me to the ER, right? Don't take me to the acupuncturist, because at that moment, I belong to the ER, right? In the same way, if I have some mild headache, please don't give me Vicodin or Percocet, right? I need maybe, magnesium, or I need maybe, a massage. Because jumping is, I guess the art of medicine is knowing when you need something, how you need something, and where you need something, and how to combine that whole thing. That will be in the physical aspect, right? Now we go into the mental aspect. How do we balance somebody's mental aspect? And I think counseling and psychotherapy is the best way to go there, We all have these unresolved emotional issues from our childhood. the way your father treated your mother, the way your father treated you as a child, it has a huge, huge impact in the way you will behave now. The way I think now, the way I feel now, the way I behave now, usually is a mirror of my unresolved childhood issues. If I only give you the physical aspect, we are only on the surface. We need to go deep down to go to the root cause of what's going on. And part of that is the mental aspect. And psychotherapy has a huge, huge part on this, you know. But also, if we only get into psychotherapy, we are missing the other two aspects, right? Now we go into the emotional aspect. What does it mean? Emotions, right? The most intimate things we have in our being are our emotions. And the three main ones are grief, fear or anxiety, and anger. Grief, depression, fear, anxiety, and anger, right? If I have depression, what do I do? Usually, or what people do, I try to forget about it, right? I try to push it away because nobody wants to be depressed, right? I want to take a medication, I want to go to working out, right? But deep down, at some point, you have to stay with your depression, stay with your grief, stay there, stay there with your anger, stay with your fear. Otherwise, you know, what you push away will come back to you stronger. There's a saying that says, what you resist, persist, right? So at some point in your life, I mean, not at the beginning, because at the beginning you are so overwhelmed, but at some point you have to do your meditation. Bring the anger to you, the one you feel during the day, without judgment, without trying to change that, without trying to understand that. Understanding is part of the mental part of the psychotherapy. But when you stay in your emotional state, bring the anger, bring the grief, do your meditation, stay there without any condition. And at some point it will shift, you know? This is gonna sound, I mean, this is much easier to say than to do it, because nobody wants to have this anger, nobody wants to have this grief, nobody wants to have this fear. But at some point we have to stay with that and fully love these emotions. The more you, at the end, love this emotion, they will transmute and transform into energy, you know? And they say that your worst emotions are the fuel for evolution. So once again, this is much easier saying than to do it, but that's how I try to live my life, and that's how I try to share this with my clients when they are ready to do that, you know? And now we go into the last aspect, the spiritual aspect, very important. All of them are very important. All of them are equally important. What we do in the last aspect, spiritual, we're trying to do some relaxation techniques or meditation, super important. For me, meditation has been the foundation for my life. I had a chance to do meditation since I was 15, 16 years old, on and off, you know. But that's something that I really go back, you know, because super important. And the way I do my meditation, there are different kinds, but the way I do it is just focus on my breathing pattern. I don't try to change nothing. I don't try to do anything. I don't try to think anything. Because for me, meditation is about undoing. I don't want more to do. I don't want more drama. I just want to undo. And the best way to undo for me is breathing and feeling. Go to the basic. Feeling your breathing pattern and feeling your emotions. Whatever comes to your mind, let it pass. Don't fight it, okay? Also the spiritual part, what else we do here? I mean, we do energy healing, such as Reiki. I had a chance to, you know, I'm a Reiki master, you know, and I also do that with my clients and with myself. And the best way you can do that is to yourself and to your environment, to your place of working. Why? Because that will irradiate to your clients, you know. I had a chance to learn some kind of feng shui, the Chinese art, but also in India, Ayurveda, they use something called Vastu. Vastu, I believe, is similar to feng shui, but in the Indian tradition. And I arrange my office, my clinic, in a Vastu environment. So when people come here, you know, they feel the vibe. And how do we do that? by aligning the chakras and the doshas, with visually the way you smell and what you hear. Usually I play mantras in my office to keep the office clean, and I have these fresheners especially designed to balance the doshas, the pitta, kapha, and vata. Something else spiritually, something else that I had a chance to do is sound healing. Okay, sound healing, that's my passion. I had a chance to study that briefly, once with Deepak Chopra, and then playing with crystal singing bowls. And also I play mantras here. And that also goes, that really bypasses the physical, mental, emotional, and that goes straight into your energy, straight into that. And it's well known to balance, you spiritually, So that's briefly, what I mean by balancing the physical, mental, emotional, and spiritual aspects in anybody who comes to my door. And that's what I do here in my office in Camp Hill. Any questions for me? Any clarification that you need to ask me?
I love your work. I love the approach that you've taken when it comes to the mental health. The psychiatry field, I mean, they have helped a lot of people, but a lot of changes needs to happen. I love the way how you're looking at the whole person approach and how you have it all broken down. When you talk about food, I want to say like 80% of the, is pretty much the driver of all to see changes in, when you begin to remove, if you have addicted to sugar, if you, anything that's going to drive, reduce your mental thinking, emotion, when it comes to taking some of the toxins out of your system. You definitely get to the root cause. The fact that you do a blood test just to get to the bottom, what's deficiency, what's low, what's lack of. So when you lay out program, of course, every patient's different. Are you able to integrate most of these modalities, or based on a client, or
yes,
basic?
I see your question. Yes, I'm lucky enough that the ones who come to my office, they come because they are already looking for this approach. So that makes my life much easier, And yes, for example, somebody coming with depression, right? For the first time to my office, right? Yes, I will the whole psych evaluation, like a regular, board certified evaluation. And yes, I will check their issues that I can help them with. I also advise for diet, no dairy, no wheat, no soda. I advise for exercises, especially cardio. I will do the blood work to be sure they don't have any deficiency in their vitamin D, in their thyroid, all these things I need to know. I will do a brief quiz to find their dosha. Usually people with more depression is because the kapha dosha is imbalanced, usually. I don't try to generalize, but usually like that. So usually using something like turmeric, amazing to lower the kapha dosha, therefore feeling better in depression. Also vitamin B complex, 100 milligrams in the morning, amazing for depression, And yes, if they choose to go for medications, I advise to do the gene site testing, because that will tell me more accurate, 99% accuracy, what medication will be more beneficial, which I will not, before even trying that. And yes, I will advise for counseling. I will talk about their emotions, how sometimes if they feel depressed. I mean, nobody wants to be depressed. Nobody wants to feel a depression. It's horrible to feel depressed. But at some point in your life, you have to make peace with your depression. At some point you have to do it, because we cannot be running away from our emotions all the time. because they are faster than us. They will always catch us, you know. So we have to stay with them.
Mhm.
We have to feel them and truly change them, you know. And yes, I would advise for meditation, for Reiki or sound healing, you know.
That sounds amazing. I know you said a while ago about the sound healing, sound therapy.
Yes.
Oh my gosh, that's very supportive way of healing for people. And when you talk about healing, we talk about sound, it could be any form of sound. I mean, some people prefer maybe the drumming, you know, like, you know, drum circle, or you know, when we talk about sound, it's creating that vibration within, and that creates energy, and then stimulates anything that it's, especially the brain loves rhythm, and that sound that you are offering, I think that's I love that. I like the fact that when you're doing the blood test, not only checking for genes, but the hormones. And I love the part where you talked about men. I mean, they always talk about hormones. It's always the female people, the female group. And that's such a taboo. People, you know, the guys don't want to talk about, but they got hormones too. And a lot of the hormones deficiency, it can also affect the mental status for sure. So I love that you brought that up. So
Yes,
I'm sorry.
I like to combine the best of each world, you know, the best of Eastern and the best of Western medicine to get a real approach to it.
I love it. Asha, do you have?
Yes. First of all, I love the scope of your practice. I just think you have a practice that is really a practice of the future that will become more and more known and wonderful to people. I love that you integrate the energy aspects of life, because I think people still have a lot to know in that, you know, department. I think you're a very curious guy, meaning you love to search out things that just appeal to you, and then you investigate. That's my take. Also, where is your office located? And then the last question I had was, does insurance cover any aspects of your practice?
Excellent questions. My office, my address is 3461 on Market Street, right across from the Good Shepherd Catholic School, almost in downtown Camp Hill.
Camp Hill, Pennsylvania.
In Camp Hill, yes. Yes. And yes, now we talk about insurance, right? That's the tricky part. Yeah, there's no insurance that will cover all these aspects, right? So I had a choice when I opened my practice, right? Yes, I work with insurances, yes. I have to say, you know, that I get paid like any regular psychiatrist, just giving away medications. Because otherwise, you know, I mean, insurance, they will not pay anything extra for this extra approach. But I'm okay with that, you know, I'm okay with that. I have a chance to help people the way I really want to, and I really feel that. I think they should be helped. But insurance will not take this approach, but I work with two insurances, yes.
Does the insurance cover lab work, blood work, things like that?
Yes, most of them. Also, you know, different insurance, they have different plans. And that will depend on the patient plan directly, yes.
How long have you been in this area?
In this area, with my own practice, like 3 years.
3 years. Oh,
but in the area, maybe 3-4 more years before that, yes.
Okay.
I think it's wonderful. Absolutely wonderful.
Oh yeah, I praise your work as well.
I used to work in a hospital before I opened my own practice, so I was kind of, you know, I couldn't really do this, you know. But when you work in a hospital, you have to, you know, follow up your guidelines, and that's okay.
Right.
brought me to open my own practice, and now I can really, really use all these modalities that I feel have an impact on my clients.
You feel like it's the right thing to do, and it's a passion coming within from yourself. Then you feel like you thrive, even though, of course, you said it, you know, with the insurance. But like Ash just said, you know, this is becoming a movement that is moving as not as fast as we like to, but it's moving, you know, and that's why these talks that we're doing, and just allowing people to know that, you know, individuals, you know, entrepreneurs like yourself exist out there, and the amazing work that you're doing, and giving people choices, that not just one thing or two things is that all can do, and they just feel like they're stuck in it. But given all those options, there's so many choices that people have to treat any conditions, and, you know, and different things. One thing I do want to say that I'm sorry I didn't bring this up at the beginning of our talk, and I always do before we finalize here, that anything that we discuss here today, it was just for information only. That is not to diagnose, treat, or cure any condition or disease, and that you know, speak with your doctor if you want to change anything on your care plan. So I always said this at the beginning, we just got carried away and excited to have Kristen begin to talk, that it's there. At the beginning or the end, it doesn't matter. So any final comments you want to mention, Kristen?
Well, I would say that thank you for the opportunity to be here talking to you both. Thank you for giving me the chance to explain about what we do here in my clinic.
Yes.
And I welcome anybody who wants to have a thorough integrative approach to their mental health issues to, you know, to come to see me.
Of course. You want to provide an office phone number, an email, and website?
Okay, yeah, my phone number here is 717-603-3700, and my website is Dr. Kcomt Center for Well-Being.
Excellent.
Yes.
Okay, I know when we advertised this last week, there was a sheet that I have out there on Facebook, so it gives an overview of what we discussed today, and the contact information if you want to reach out, you know, to Dr. Kcomt for just to get to know, you know, his program. So, okay, our time is running out, and we want to thank everyone for your time. And so we have another one next week, and look forward to see everyone. Thank you. Bye-bye.
Okay.
Bye.
Bye.